want you. You can take all the cash too. Mama wait for the part too. I go shower you with love. They body like a tattoo. Jealousy with the fight you. Make a hammer you last too, yeah. Cause I can do better than they do for you. I can do better than they do for you. I can do better than they do for you. I can do better than they do for you.
Pull up in the Balandia, you don't need to explore, do your thing, baby. Pull up in the Balandia, you don't need to explore, do your thing.
I can do better than they do for you. I can do better than they do for you.
Check. When I'm making no day disappear, me I get it out there for your day. Girl, I make you know they run away. I won't bend you like you won't sit for chair. Give you my fingers if you care. We no be strangers, so mind you. Look at my way, I'm my way. I'm gonna make you wait. Oh, why you won't craze? I'm in the way, with you get. Oh, body today, make I feel like me. 'Cause I know you want that me. Make I know. Oh, body today, make I feel like me. 'Cause I know you want that me. Make I know. Today, make I feel like me. 'Cause I know you want that me. Make I know. Today, make I feel like me. 'Cause I know you want that me. Make I know. See it to you, not to me, I want it. Everything about you lovely, put it on my bed, show the wine like Beyonce. Ginger me thing, make I give you something. Sound like time out of action, drop it down low, let it do any long thing. Look at me, I'm my way, I'm gonna make you wait. Oh, why you won't craze? I'm in the way, with you get. Oh, body today, make I feel like me. 'Cause I know you want that me. Make I know. Oh, body today.
So physical money and put me to wrap to say. For me, send you my in a minute in Sabakandria and then one Taptap Send.
Yeah, Ebushanfo, we didn't did an Akuma Pachlewa one. They recommended Taptap Send a mama. And that's how for also for baby. Diabasa, our rating so yeah. Omo ye A1 nti obian load do Taptap Send na all sense ka for Taptap.
You won't do it, Amansan. You won't do it, Gala for say. You walk on to near this coffee here. May and friend for the VR, giving me a tap at the move you are. Taptap Send in this street.
The tap with the one.
Taptap and one in a
Piao.
After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Sultan Sky, a new perspective in the sky.
Go through. So just first of all, I want to give a warm welcome to everybody joining the show. Shout out to the people and on those who've joined us via Facebook and YouTube. And just to say, this show is brought to you and sponsored by Taptap Send. Now, today we are going to dive into a topic that affects every man, yet often goes undiscussed: male hormones. And from energy to mood, muscle, motivation, hormones play a major role in how men feel every single day. So to help us understand this better, we're joined by our very own resident doctor, Dr. Akos, who doesn't necessarily specialize in men's health, but she says she's going to now specialize in it to talk us through it and help us delve into it more. By the way, my name is Abina, and both myself, I did say my name is Abina, but together with Dr. Akos, we formed the Oasis. So now, Dr. Akos. Hello.
Hi. Yeah.
So I think the floor is yours, and we look forward to hearing about male hormones.
Yeah, so thank you for having me. Today I'm going to talk about male hormones. And you're quite right. I was thinking to myself, everybody specializes in female health these days. And I was like, where are the people specializing in male health? So I've decided that I'm going to go into male health. So that's going to be my niche now. So I'm going to specialize in male health.
Good choice.
I'm going to leave the female side of things to Dr. Kujo and co. Okay. So obviously, as you know, I said this last week, but November is Men's Health Month, essentially, is Men's Health Awareness. So this month, we're going to be doing more and more on men's health. And essentially, last week, we talked about prostate cancer, we talked about testicular cancer, we talked about how hormones can affect men, and today I'm basically going to hone in on the hormone side of things. So again, as you know, this is the only show where you can ask any questions to do with health. You can ask about male hormones in particular, what I'm talking about, or you can also ask any questions about anything else. And just to say as well, I'm also live on TikTok, so for those on TikTok, hello. And yeah, the same goes for you. You can ask any health related questions, or if you want, you can ask any hormonal male hormonal related questions. But I'm doing the presentation first, and then I'll answer questions at the end of the presentation, so do bear with me. And thank you, sister. So there are different types of male hormones, and there's so many that we can talk about today if we wanted to, but I'm going to concentrate on testosterone, which is basically the main male hormone. It's not the only one, but it's the main one. Okay. It's produced mainly in men's testes. So kind of says it in the name, doesn't it? Testosterone, testes, that's where, and another name for testes is the balls. I guess that's a common name of what people will know it by. It's important because it helps with muscle growth, mood, sexual health, and fertility. And a lot of people sort of know testosterone for its mood, its sexual health qualities, and its fertility qualities. But a lot of people don't actually know that it helps in terms of with muscle building up and energy as well. So it does a lot of other things aside from that. Okay. It supports bone health. It influences a man's mood and confidence. It drives libido, which is basically sexual desire. So anybody who's got low testosterone might have a reduced desire to have sex as well. And it helps in sperm production. So it kind of goes hand in hand. And I'll come to that in a minute when I talk about something else. So when testosterone is low, what happens essentially? Well, it can, for one, when can it happen? It can happen at any age. A lot of the time it's more common after the age of 40, and that's just physiology, but it can happen at any age. It can happen in younger adults as well. And it often goes unnoticed because it doesn't really have a very specific symptoms. As I mentioned, there are the main symptoms that you might look out for, things like low energy or fatigue, but you can get that with anemia as well. You can get that with anything really. So that's not a very specific symptom, is it? Reduced sexual desire, erectile dysfunction, loss of muscle, increased belly fat, and low mood or irritability, reduced confidence and motivation. So these are really non-specific symptoms that essentially, you can literally go days and weeks wondering what's going on, and it could be that you've just got low testosterone. Most people don't think about your testosterone levels initially when you start feeling these sorts of symptoms. The risk factors for having low testosterone are things like being aged over 40, being obese, so having a little bit of extra body fat, having diabetes or high blood pressure, being chronically stressed, having poor sleep, drinking excess alcohol or smoking, and also the one that's probably most noticeable is having any testicular injury or testicular surgery. Because if you start to experience these symptoms after you've had a testicular surgery or injury, then you'll probably start thinking to yourself, actually, there's something not right. But all the other ones, you probably wouldn't start thinking to yourself, this is coming from my testicles, would you? So it's very difficult sometimes to actually realize and pinpoint where the symptoms are coming from. As I said, the symptoms are very non-specific. Okay. How do we diagnose low testosterone? Well, it's a simple blood test, really. So if a man comes in and he's got some of the symptoms I talked about, just being fatigued, low mood, a lot of the time if they say something like they've got low sexual desire and things like that, obviously, as a doctor, I'll take a history. I'll do other blood tests as well, but I will probably include testosterone in there just to make sure, and especially from the history as well. If you've had normal sexual desire your whole life and you're now 40 and you're suddenly telling me that you suddenly lost sexual desire, especially if you've been married to, let's say, you've been married for 20 years and you've never had any problems libido, and all of a sudden you're telling me you suddenly have low libido, then I'm going to say, okay, I'm going to check your testosterone. So some doctors might not do it immediately. They might check more specific things like your blood levels first. And then wait for if that comes back normal, then check the testosterone. But I'll just tend to do them all at once because you only get bled once. The test is often, we like to do the test in the morning for accuracy because that's when your hormones are highest. And then we might check other things as well. I talked about blood sugar, especially diabetes can also affect libido and things like that. Diabetes, blood pressure. So we'll just do a full MOT basically. Okay. Now, how do we treat low testosterone? Well, the main thing is actually a healthy diet and weight management, because you'll be surprised, but a lot of the time the low testosterone is caused by, like I said, from obesity. And so the way in which it links is that having extra body fat actually produces estrogen and can convert testosterone to estrogen. So yes, estrogen is known as a female hormone, but males also produce it. And having extra body fat can sort of almost facilitating that production of estrogen, which can then lower testosterone. So that's like the first point of call: healthy diet, weight management, dietitian involved, that sort of thing. Regular exercise, especially strength training. We'll advise to improve sleep and reduce stress, because these are things we know can also affect it. Limit alcohol intake. I know a lot of people don't like it when I say this all the time. Where's Jonas? Jonas will literally have my head for this, but literally limiting your alcohol intake, stopping smoking. In some cases, we might do testosterone replacement therapy, but we hardly do that unless we need to. And I would advise to never start testosterone replacement by yourself unless you've been advised by your doctor, because there are other side effects that it might have, and there's so many things that we need to check when we're replacing your testosterone. Okay, so definitely don't start it without doctor's advice. But yeah, that's something that we may consider. So it's important to just make note of that. Complications of untreated low testosterone is things like reduced fertility. So as I mentioned, your testosterone does help in the production of your sperms. So if you've got low testosterone, then you can get reduced fertility. You get weak bones, also known as osteoporosis, medical term, increased body fat, risk of depression or low mood, and reduced quality of life. Really, as I said, testosterone is really the main hormone that gives men strength and gives them the sort of muscle. So if you've got low testosterone, then a lot of the time you might have reduced quality of life. So it's a really whistle-stop tour, or just a really short talk today, because we're only talking about testosterone really, but it's just to let you all really know that testosterone is an important hormone. The symptoms of low testosterone is really, really non-specific. So we would advise you to do yearly checkups for hormones and things like that. Talk about your health openly with others, because sometimes you might present with some symptoms that are not really normal to you yourself, and somebody might have gone through it already. So you might be talking about how you're feeling weak or feeling non-specific, and somebody might say, oh, when I did that, my doctor checked my testosterone, they were really low. So it's just really important to check these things, and then early management improves well-being. So it's just, as I say, the message today really is just men talk about your symptoms, because men don't tend to want to talk a lot about how they're feeling, what they're doing. They just, a little bit random. So yeah, that's it really. That's all my talk is about today, just hormones. And yeah, I'll take questions now. After the advert, of course.
I was going to say, well, thank you. That was easy there. Dr. Akos was very eager to take some questions. And thank you very much, Dr. Akos. Short and succinct, yet very very informational. And so, as we usually do, we'll go for a quick commercial break, and then we'll come back, and then we'll start the Q&A session. So please stay tuned. Okay. Hi, everyone. It seems we're having some technical issues, and we won't be going for a commercial break. So we'll just wait for Dr. Akos to return, and then we'll start the...
I'm here.
Okay, Dr. Akos is here. Excellent. So, sorry about that. We just had a quick breather. Time to just, refill your cup of tea, and then we're back. So as we usually do, Dr. Akos just took us through male hormones, particularly testosterone, and what I love to see is questions. And lo and behold, we have a question. So I am happy. So this is the Q&A session. So just to let you know how it goes, just in case you're new here, you can ask questions based on the topic, which is male hormones and testosterone, or you can ask questions, any sort of health question. That they'll all be welcome. So we start with Hakeem. Hello, Hakeem, and good evening. And his question is, what is the relation between testosterone and prostate health?
Well, so that's a very good question, actually, and thank you for asking that question. So if you remember last week when I spoke about prostate, I said the prostate was responsible for basically most of the fluid that comes and the nutrition that comes from the sperms, the prostate was responsible for that, and testosterone is responsible for the production of sperm. So that's where like the two sort of link. The prostate is a small gland that sort of sits. Oh, where does it sit? It sits almost behind your urine pipe, your urethra, and basically it needs testosterone because without the testosterone makes the sperms, and then the sperms gets its nutrition from the prostate. So essentially it goes hand in hand. It's like can't have one without the other. It doesn't, the low testosterone doesn't directly cause testosterone cancer, but it can be linked to it indirectly. But it's not something that we'll say it's a cause of prostate cancer. That's why I didn't really mention. I'm preempting your question here, thinking is it linked to prostate cancer? No, it's not. But it's definitely can be an indirect link to it because of its link to the semen production and sort of the semen nutrition. But it's not a cause of prostate cancer.
Excellent. Thank you, Dr. Akos. Thank you, Hakeem. Our maiden question for the day. Got another question here, which are, can men experience hormonal imbalances? And if so, what will be early signs and symptoms for that?
Sorry, what was the question?
Can men experience hormone? Why did I move forward as if you can? Can men experience hormonal imbalances? And if so, what would be the early sort of signs and symptoms for that?
Again, when it comes to hormonal, of course, men can experience hormonal imbalances just like women can. And as I said, testosterone is not the only hormone that men have. Men also have the hormones that women have. They have estrogen, they have progesterone, they have luteinizing hormone. In fact, they have almost all the hormones that we have as well. So when we say a lot of the time you hear about women experiencing hormonal imbalance, and men can go through it too. There aren't very specific signs for it. As I said, hormonal conditions and diseases, signs are very non-specific. So things like fatigue, feeling tired, low sexual, if you're having like hormonal imbalance and testosterone is involved, obviously you're going to have your low libido, you're going to have your low sexual drive. So yeah, it's not really specific. The most important thing is if you're feeling like you're not quite yourself and you're just feeling like something is not right, it's important to see your doctor about it, because obviously your doctor can run these tests and then they can basically take it from there. Even with the doctors, if you come to see us and you tell me about some of these symptoms, my first point of call will not be, oh, I think this person's got hormonal imbalance or has got low hormones, but it is definitely something that we can consider and we can add to the test as well. So it's definitely worth talking about to your doctors.
Okay. I just wanted to say to say something. So how normally women, our hormones make us irritable sometimes.
Yeah.
So does that happen to men as well? They can be very irritated or just very like short-tempered.
Absolutely. And I mean, there's so many things that can affect the way that men feel as well. So aging, obesity, chronic stress, poor sleep, but these all affect your hormones, which then it's almost like a cycle, isn't it? Which then affect your mood. Remember I spoke about having low testosterone can also have can destabilize your mood. So definitely men can also have mood swings if they've got hormonal issues and hormonal imbalances. Low energy is a big one for men though, and like I said, reduced libido as well. So is worth checking out. Any man who comes to me for low libido, I'm definitely doing a hormonal test. But again, it's sometimes important to even low energy. Everybody thinks about anemia when you think, oh, I've got low energy or I'm feeling really weak, but a lot of people don't tend to think about hormones, but it's a very important topic that I think we need to start looking at and testing.
Excellent. Thanks, Dr. Akos. My next question was actually going to be what causes male hormonal imbalances, which I believe you touched. You said fatigue, chronic stress. Anything else that's missing from the list that you could?
Weight gain, poor sleep. I think weight gain is a big one. I talked about obesity and the link to hormones. It's a really, really big one, especially for men as well. So just making sure you're exercising regularly, building up those muscles, that's going to be huge in trying to prevent these things.
Excellent. Cool. It seems like, I'm having a few questions from, a few questions backstage. However, no questions. Anyone on male hormones? I'm just looking through to see if there are any males. There doesn't seem to be any males here, but ladies, we can ask questions to learn about our partner's hormones too. But
that's the thing about male health, is like nobody's well, not that nobody's interested in it, but the men don't tend to talk about it much. So, and women will talk about everything. So, like, I feel like that's why women's health gets so much more, so much more screen time in a way. But whereas male health, men will just kind of like just keep quiet, hush, hush, and just sit in the corner. But it's very, very important because male health is also very important. There's so many things that affect men they never talk about. So, I think it's very important.
Yeah. Well, I think you touched on the fact that it's not just. I mean, with you specific. That's the word I can't ever mention. You specifically focused on testosterone. But obviously, you did mention that males have other hormones, particularly all the hormones that we women have, just maybe like a little bit more suppressed. So, which hormone is testosterone like the most important hormone to a man? Is that why there's so much emphasis on it, or which other hormones are also really important to a male biological sort of system?
I mean, I've kind of talked about the male hormones as well. So again, I'm just going to talk to my TikTok family. Thank you guys for joining now, Kylie. Thank you so much for the love you're showing. Because I'm doing two screens at the same time, I'm also on Zoom, so I'm concentrating on the questions on Zoom. But if you've got questions on TikTok, please do write it, and I will answer it. So yeah, back to your question. So testosterone is definitely the main hormone for men. But like I said, men have other hormones as well. So we have DHEA, which is basically a precursor to testosterone, and that's basically the hormone that is made before testosterone. That's an important one. We've got estrogen, we've got progesterone, luteinizing hormone. There's so many other hormones that are involved in the whole sexual process and the whole libido process of men. And they're similar hormones to women as well. But the reason why we concentrate on testosterone is because it's basically the main one for men. And that's the one that produces the sperms. So essentially, if testosterone is down, then sperm production is down, fertility is down for men. And that's obviously a huge thing for men. So, but there are definitely other ones as well that are important in the whole process. So it's worth thinking about.
Okay, great, excellent, thanks. I've got a few questions here that I'm playing with since
So we're talking about male hormones and mainly testosterone and how male hormones affect males' health. So the men on the screen, you got to ask the questions because women tend to do all the talking sometimes, but men don't tend to. So this is a platform for men.
Yeah, and speaking of which leads well into this. So I'm going to talk about the stigma around men discussing, which probably is one of the reasons why we see men don't really talk much, because there's a stigma on them, I guess, expressing vulnerability. But yeah, so just back to the question, there's often stigma around like men discussing fatigue, low mood, or sexual health, as we know. So how can we encourage these open conversations to go on among the male community, among all of us as a whole?
Yeah. So I think the most important thing with the whole male thing is men don't like, number one, well, from my experience, I'm not a man, so this is what makes it a little bit difficult when we're talking about male health from a woman's perspective, obviously. But men tend to not like to talk about private or what they find are private things. Okay. And that comes to anything, about their relationships, about, what's going on in their lives. They just tend to bottle things up. And also, again, in the African communities, there's always this stigma about how men are the big bosses and men don't cry. In Ghana, there's this saying like and things like that. So men, I feel that always feel like they have to be the men, or they have to take, they have to have a pair. They have to have a pair of balls and not to discuss these things. I think creating an environment or a platform like this where we can say to men, you're more than welcome to come and talk about how you're feeling, to come and talk about your health. And this is why I always say the GP's role is very, very important, because if the men listening on this platform, you don't have to go and gossip with a friend or go tell a family member. You can literally just go to your doctor. Doctors don't judge. I don't know you from Adam. You're my patient. It's my job to look after you. So you can just go to your doctor and you can go with anything and everything. You'll be surprised some of the things that we get from our females. Some people can come up to, they'll literally book a GP's appointment and come and sit down and tell me, Doc, I'm struggling to pay my bills. And I'm like, oh, I don't know how I'm going to help you with that. But, like, but it's a mental health thing, isn't it? And even the fact that they've come in to talk about that, they're releasing stress of themselves. And women will do that, but men won't do that, So I think it's just about making men aware that there are these spaces, there are these safe spaces where they can go and talk about whatever's wrong with them. The women in the men's life, I think creating an environment where a man feels like he doesn't always have to shoulder the heavy stuff and that he can actually open up to you. So even sometimes just asking about it, being like, if you as a female, if you're married or you've got a male partner and you're going to the doctors or, you're going for a checkup, just ask your man and be like, oh, when's the last time you went for a checkup? Do you want to go together? They might say no, or they might say, oh, you know what? I haven't been in a while, I'll book it. But, just also checking up on them and making sure. And then they might get comfortable and say, oh, actually, she cares about my health. Maybe I can talk to her about these kind of things, So it's just about creating those spaces and creating those platforms where men feel comfortable to talk about these things.
Oh, great, excellent. And would you say men should consider getting their hormone would you say men should consider getting their hormone levels tested, and how should they go ahead to do it, and how often would you sort of like recommend?
So again, yeah, because we're talking about the NHS here. So if you're anywhere else, I'd say, I'd say, yeah, definitely do it once a year. But you can't just go to your GP and decide to get hormone levels tested. Like, it's not a test that we do routinely. So even when we do routine tests, we might do like your full blood count, we'll do your urine, we'll do kidneys and liver, but hormones are not something that we'll just chuck on. So you kind of have to have some symptoms, or at least have to have a reason why you need to do these hormonal tests. Now, if, like I said to you, if somebody comes to me and they said, I've got low libido, or, I'm struggling to have sexual desire on top of being tired and having all those symptoms we talked about, then I'll definitely check on a testosterone test. Sometimes you can actually request it as well. So lots of people don't know this, but sometimes GPs won't think about it immediately, because if somebody comes to me and they're feeling tired all the time, I'm not thinking about their testes immediately. I'm thinking about like low blood, because that's the first thing, that's the most common things. But sometimes patients can say to me, oh doctor, I was reading about this thing online which talked about testosterone. Do you reckon we could test testosterone as well? And I might say, oh, then I might ask you a few more questions, and I might say, actually, I think we should check on a testosterone, because I think it's important. So yeah, it's definitely good. This is why having these platforms is important, because it's good for you to have knowledge about what's available to you, what symptoms to look out for, and what you can actually ask your GPs for. And then obviously in the same way you can also, but I really doubt that you're going to get a yearly testosterone check. If you do it once and it's normal, that's pretty much going to be it.
Oh, okay.
On the NHS, unless again your symptoms change, and so unless you're going to your GP like every year and saying, GP, around August every year I feel like I've got low libido, and then at some point your GP will be like, this guy.
Of course, this focus is. Will that be the same for women as well? Do women experience that in terms of like getting hormones checked?
I mean, we had, again, even with women, we hardly check the hormones. Like I always say, there are people so we can check hormones for menopause, but even with that, we hardly check it. So according to the NICE guidelines, which is National Institute of Clinical Excellence, which is the guidelines that we use in the UK, if a woman comes in and they're a certain age and they've got menopausal symptoms, it's a clinical diagnosis. I don't need to check your hormones for that. If you're below 45, I believe it is, and you've got symptoms of menopause, then I check your hormones, because to be honest, 45, you're kind of still not there yet. So, if you're above 45 and you come to me and you've got like menopausal symptoms, I have no indication to check you, because I'm just going to say you're probably perimenopausal. I don't even have to check your hormones. I just have to say to you, I think you've got menopause. So that we don't tend to check the hormones unless there's a clinical or significant reason why we need to. In men, it's different, because obviously if you come to me and you say you've got low libido, then I am inclined to check your testosterone, but that's probably the only reason why I would check it. Like I was saying before, it's not like there's I can't think of any other reason why I'd do it, really.
Oh, okay. That's interesting. Cool. That's an NHS problem then. Okay. And what are the benefits of having testosterone replacement therapy for men?
Well, the benefits are it's replacing testosterone, isn't it? So, because
So I guess, does it have an effect on sperm production?
yeah, absolutely. And again, it depends. So if it's just the low testosterone causing low sperm production, obviously if you're replacing the testosterone, then you're gonna get the idea is you should get, it doesn't always happen, but most of the time you get your testosterone production again. But like I said, there are side effects of testosterone replacement, which you really don't want to overdo it. And there are side effects to other hormones and its effect on other hormones. And the main one is that if you take testosterone replacement without needing to take it, then what happens is there's something called a negative feedback that goes to your brain. So the way your body works is your brain tells your testes to make testosterone, and then your brain tells your thymus to make testosterone, and then it goes down to your testes, and then testosterone goes and helps with sperm production and helps with other bits and bobs. Okay. Now, if you are taking testosterone, your body picks that up and your brain picks that up and says, oh, we've got enough testosterone, so we don't need to make any more. And your brain shuts down your testosterone making machine, which then means that in your body actually stops naturally making testosterone. And it's only relying on the testosterone tablets or the replacements that you're taking, which can be dangerous because sometimes when your brain stops that, and if it stops it for a long time, your body actually forgets how to make testosterone, which means if you stop taking the tablets, then your body permanently doesn't actually know how to make testosterone. And that's the same with most steroids and hormonal treatments. And that's why we say don't take testosterone or don't take steroids without informing your doctor, because what we do is we track it. We track how much you're taking. We track how much your body's responding to it. We do blood tests. We check that we know your body's not forgetting how to make it. We check that everything is in line. But if you go and do it yourself, you're not checking all these things, which then means that obviously you can end up having these side effects, and you can permanently become infertile from overtaking testosterone. So it's important not to take it by yourself.
Very important. And so in that, so on that line, or should I say, in that breath, how can men naturally then boost their testosterone?
So we talked about sort of obesity being one of the main issues for having low testosterone. So exercising is very important. Building up your muscle, exercising, making sure you're not having extra body fat. Very, very important, because like I said, fat creates estrogen. So the more estrogen you create, the more testosterone you don't create, and it almost goes hand in hand. So making sure that we're not obese, eating regularly, exercising regularly, and just living a healthy lifestyle. Really, stress is a huge one as well. I know it's easy for me to say avoid stress, but if you're working in a stressful environment, sometimes you can't avoid it, but just have ways in which you can manage your stress. So if it's you need to take a 5-minute break, you need to have your mindfulness, you need to take a plantain break, whatever you need to do. You need to take a tea, coffee break. I'm not going to say a smoking break because I don't agree with smoking. That's why I said plantain break. If you need to take plantain chips break, take it. You just need to find a way to de-stress yourself, because stress is also a huge factor in sort of causing low testosterone and low hormonal imbalance.
Oh, okay. Also, just to chip this in, because there are no questions coming. So you mentioned weight increasing estrogen in the body. Did I say that right? Estrogen. But is that the same with women as well?
Yeah.
Okay. So interesting. Okay. So it's just and for a woman, if you have loads of estrogen, I guess you're not producing the other one. What's the one?
Progesterone. So estrogen in women it works a little bit different, but estrogen overproduction of estrogen can do a lot of things, but it can also cause things like breast cancer. So we know we spoke about this during last month, breast cancer, but estrogen is one of the hormones if it's overproduced, it can actually cause breast cancer as well. So we need to just find, and it can have poor bone health as well. It can cause poor bone health as well. So you just need to be mindful of some of the things. But having extra bodily fat does increase your estrogen, but it depends on there are other factors that can be involved as well. I don't think having just a bit of extra belly fat is going to increase your estrogen to the point where you're going to end up getting breast cancer. I don't want to scare people out there. But it's just something worth thinking about. It's combined with other environmental factors as well. Okay.
Such as?
Auntie Amma, you already know answers to that question. So you should...
She's
I'm just
asking for the
asking for
benefit.
the sake of
Yes,
people
for
who
the
don't
benefit.
know.
Exactly.
So
I
I'll
agree.
leave.
So I'll let you answer that question because I miss your voice. And it's been a while we heard from you. And I'm sick of hearing my voice today, actually.
No,
Nobody
I
else is
want you
talking.
to answer. I've asked some questions and you didn't answer it.
Well,
Private message.
I've not seen. I apologize. I'll go and see it. I'm just...
Okay, please go back and then we'll talk about this estrogen issue because there are quite a few women. Well, quite a few women I know, and I'm number one. I'm estrogen positive, and when estrogen, and I've maintained my weight. I'm very good with my weight. I don't put on weight. I try not to put it on. I work on my weight very well, but I don't know, for no reason. I'm estrogen positive, so I'm very, very careful what goes in and what comes out. Yeah, but sometimes you can help it, and I think naturally, I think that's how my body. And what you said about bones is very, very true. When you are estrogen positive, you have issues with your bones, and I'm actually going through high rates of inflammation.
Yeah. So, I mean, okay, I mean, from the point of view, from what you're talking about being estrogen positive, that's a bit different. So, the fact that you've got the estrogen positivity, that could just be a genetic factor. That doesn't just mean that you're making extra estrogen. It could actually be a genetic factor that's affecting, the kind of receptors that you're having.
PCOS.
Pardon?
PCOS.
I don't, was it, what was that?
PCOS.
Oh yeah, PCO. Yeah. Sorry, PCOS. So polycystic ovarian syndrome as well. Yes, that could be a factor. I mean, when it comes to the estrogen, the receptions in breast cancer, is that we don't truly understand that, and it's truly difficult. But we know that again, if you think about even breast cancer in itself, there are people who just get it and have no genetic correlation to it, and there are people who obviously have the BRCA genes in their families that run in the family. So it's really and I mean we even have progesterone receptor positives as well when it comes to breast cancer. So it's really, it's really a topic that is not very well understood, and there's still a lot of research being done at Cancer Reach and things like that. So it's difficult to say at that moment, but I think, like I said, obviously the environmental factors is always going to be things like, again, and I know that obviously for you this was different and you didn't have any of these factors, but even things like smoking, diet, exposures you've had in the past, medications, all of these things sort of, and sometimes stress, and sometimes these things also just happen. Unfortunately, I've had so many patients who've come up to me and said, "Doctor, I've lived such a healthy life. I don't eat this, I don't eat that. I'm pescatarian. I never eat red meat, and I've still ended up with like cancer." And and they're almost wanting answers from doctors, and we are kind of like, unfortunately, the body just works how the body works. And yes, there are risk factors, and that's why we tell you lower your risk factors. But sometimes, unfortunately, some people just get it, and it's something that we can't help. So, but the estrogen is definitely something that is important for bone health as well. So if your estrogen is actually reduced, you start to get weaker bones. And what happens is, that's why when women are over the age of osteoporosis. So when women are over the age of 50, we tend to do a lot of tests in terms of bone thickness, things called a DEXA scan and things like that, because you can end up getting what we call osteoporosis, which is basically weak bone density, and that's
bone density.
And that's because of the lack of estrogen. So it's important to get estrogen is very important, but that works in men as well. So this comes back to your question about men, where if men have got the lack of estrogen can also lead to bone problems. So it's important to have estrogen, but it's important not to have too much, in a man.
Just a question. Did you not say that weight gain increases your estrogen?
It does increase your estrogen. So
100%.
Does that not also have an effect on your bone, in the sense that
it does? So basically, the weight gain increasing the estrogen is like, so you know how they say too much of everything is bad? So there's a balance, and then that's what we say when you've got hormonal imbalance. So essentially, you'd have to have the right balance. You can't have too much. And because if you think about the estrogen role in men, especially, it converts the DHEA gets converted to testosterone, which is basically that pathway is a bit imbalance when it comes to estrogen, having too much of estrogen. So you have to think about, and then the testosterone also increases muscle health in men. And if you think about muscle health being tied to bone health, and basically everything is almost tied together. So it's I can't the pathophysiology is very deep, and we could get into it, but it's important to understand the very basics of it.
Okay.
Okay, Dr. Akos, if no one will ask you a question, I need to ask you a question which someone asked me, a man, it's regarding men.
Okay.
What is the cause of HS? It's like a dermatology issue, right? Like balls and then pus and all. It's called HS. I can't mention the full name. It's called HS.
What is the cause of it?
What is the cause of it in men? Because haven't heard any man who has got it. But someone did ask me this question, that what is the cause of HS? And I said, really, it's something I haven't read about. Maybe because it's not a women issues.
It's not. So HS is, I can't mention it. Hyper something separative. Basically, it's a condition where you get a lot of you get like boils, and you get like a lot of boils coming through hair follicles, and you get like infected boils, and it's quite painful. So it's quite a painful condition. Again, like you say, a lot of the time we get a lot of patients who are females who have it, but it's not a female disease, because anybody who's got hair follicles can essentially have it. People who have diabetes tend to have it a lot. In terms of what causes it, why it happens, it's something that we're not entirely sure of. But we know that diabetes is a main cause. Having female gender is a main cause of it. But for a man having it, if a man were to have a HS and they were to present to me, I would do some blood tests. I would do definitely a diabetes check, because a lot of the time we know that people with diabetes have more of a likelihood to get things like boils and things. So that's what I would do. But there's no
this person is not diabetic.
Yeah, but I'm saying there's no rule to say that is why would men get it. It happens in anybody. There's no rule to say why this person will get it or why this person wouldn't get it. I don't know why women get it more. We just know that it happens more in women, but men can have it too. And there's no explanation for it. It's not very well understood in that way. But even the treatment for it in itself is not very well understood, because what we tend to do with HS is, we tend to, if it gets really bad and it's painful, we tend to drain it, and then we tend to give antibiotics for it. But I mean, we don't actually do anything to cure it, because we don't really understand it very well. So
okay, this person has been on. Is it Claire? Oh, come on! I've forgotten that it starts with CLA. Is it claritomycin?
Maybe.
Yeah, but this person has been on it for, I think it takes every 4 months he has to go on it. And we know the effect of antibiotics on our health. And aren't the doctors or these antibiotics reducing the immune system of these people with this such condition?
Well, the thing is, we need to look at the benefits outweighing the risk, or the risk outweighing benefit either way. Okay, so we know that there are conditions where we give prophylactic antibiotics. So if people have COPD or people have recurrent urinary tract infections, we tend to give them antibiotics anyway. Okay, so in this condition, if this is a condition that's coming back very regularly and is causing problems for this patient, and this patient is having to be in the hospital several times a week, or several times a month, because they're needing to drain and they're needing to be on antibiotics anyway, then we just give them prophylactic antibiotics to stop this from happening. And there's nothing wrong with that. Yes, there is an argument for, does this increase their their risk to having antibiotic resistance. In a way, it does, but we have to look at the benefits, because if the person is coming to the hospital regularly and every time they come, we're giving them antibiotics anyway, then we're basically already giving it to them. And I mean, that's the only thing that's curing them. So then we might as well just give it to prophylactically so that the person is not always coming to the hospital. So again, is the risk outweighing the benefits? So we have to think about that sometimes.
Please, I haven't really read into this, but it's something which I think it's my next topic to read about. How many researches have been done into this?
Oh, I can't tell you that.
And what are the doctors doing? Because it's on the increase. That's what I've been told. And what are you doing? Because you can't be giving someone a prophylactic antibiotics every 4 months or 4 months in a year, I mean, that's too much. I mean, this person had a bag full of antibiotics and I was scared.
Unfortunately, Auntie Amma, we can give antibiotics once every couple, but like I said, HS is not the only condition that requires prophylactic antibiotics. There are other conditions which do. And unfortunately, like I said, I don't know about the research that's been done into this or research that has been done previously. But all I know is that it's not very well understood. And there are some conditions that we just don't understand very well, regardless of how much research is done into it. This is one of the conditions that we just know that happens. It tends to happen with people who have thick hair, who get a lot of dark skinned people, they get this razor bumps and things like that. So when your hair gets trapped after you shave and stuff. So I mean, we tell people about sort of ways in which they can manage it or prevent it. So like making sure you're shaving with warm water, making sure that you're actually not shaving like cutting your hairs rather than shaving and things like that. But unfortunately, there are just some things that we just can't fix. We're only doctors, we're not God. So some of these things is difficult, but the way in which we understand it at the moment is to treat it with antibiotics, because we know that works. So I know that it's probably not, for you, it's not the best solution, but it's like I said, it's not the only one that we've got other conditions that we treat with prophylactic antibiotics as well.
Hakeem had a question and he says he has to leave. I'm very sorry, Hakeem. Well, I was going to ask your question later. I don't know if you're able to stay for the 2 minutes so that Dr. Akosua
you can ask. I'll come back to Auntie Amma.
Go through your question before you leave, and thanks for the question. So some medications may affect libido. What would be your advice to men who have been prescribed such medications? Are there any alternatives?
Well, it's difficult to answer that question without knowing the medication, but there are always alternatives to medications. But the thing is, when you've been prescribed a class of medication, oftentimes they all have the same side effects. Some might have less than others. So for example, antihypertensives used to treat blood pressure. Some of them are known to cause problems with like libido and stuff. Not libido, with erectile dysfunction and things. But some of them are known to have less side effects for that. So you could be put on the one with a less side effect for that, if that makes sense. So essentially,
metformin.
Yeah, so the answer to your question is yes, there are alternatives, but it depends on what you're being treated for. And so it'll be my advice to men who are put on the such medications is that, number one, knowing the side effects of your medication is important, because obviously if you know that this is a side effect of the medication, if you start to get any symptoms, you can pick it up a lot more quicker. So if you're on a medication that says you're prone to have low testosterone or erectile dysfunction, if you start seeing very, very subtle symptoms, you can start talking to your doctor, but you don't have to wait for the symptom to get to its worst point before you see your doctor about it. So definitely my point would know your side effects of your medications. Well, that's a catch-22 really, because medications have like 101 side effects and you don't want it. But I mean, know the common side effects of your medications. Discuss it with your doctor early. Say, okay, this is a side effect I'm worried about. If this side effect is there an alternative I can be put on? Or, do I even need to be starting on this medication? Just have an honest conversation with your doctor is what I will advise men in that situation. I hope that answers your question.
Thank you. I can't find him, but hopefully.
Listen.
His question came in some time ago, so that's my bad. Hopefully next time I'll highlight that first. But anyway, and then I think just to just to close off the male section, and then perhaps you can get back to Auntie Amma. So, do men have a hormonal cycle like women? Which is a very interesting question. I would like to know.
Oh,
And if they do, how do we track it? Are there apps for it, like women have?
it's a good. Do you know what I always joke about this, and I always say to somebody I know, and I say, I think you're on your menstruation, which is obviously, I say this to guys who end up having mood swings and stuff. Honestly, the true answer to that question is I don't know, and I haven't been. I guess we haven't been taught about the cycles of men's hormones. I don't actually ever think I've actually ever sat in a medical class and been told that this is the cycle of a men's hormone. But I gather that there is something like that. The reason I say so is because men can also have mood swings, and this is what I was talking about before. It's not just a woman thing. Men have something called andropause, which is similar to menopause. Yes, read about it, and we can talk about it later if you want us to. But essentially, men also have menopause, which means that they also have periods where their hormonal levels can decline and their hormonal levels can get less. And yeah, like I said, men have other hormones as well, and that's why they have, some men have infertility or have problems with libido and things like that. So, I mean, I think there definitely are men's cycles. I think the only difference is we, maybe unlike women who experience a monthly, very, thick cycle, estrogen rises here and that causes this, and progesterone rises here and that causes this. Perhaps men don't have such a clean cut pathway in their hormonal cycle, but I don't know. That, like I said, the true answer to that is I don't know, but I do think that they do. But that's my opinion. But this is why we need male health specialists.
Well, that's why you're going to be one. And the little research that Google has helped me do, it seems like men do have a hormonal cycle which lasts 24 hours. So they're going through that every single day, actually.
Wow.
So I guess it's good to, did someone speak or?
No, that was me. I said, I guess that's why they're grumpy.
So it's good to kind of know so that you can say, okay, 6 p.m. is the best time to talk to my husband or my partner, because according to the cycle, this is what they are.
No, I think this is very, I think when I was just after 50, we had a program at church, and it was the over 50s couples, and I was so shocked when I heard that men, when they get to a certain age, that they also go through menopause, that their libido goes very low, and somebody can't hold your name you. So it gets to a point in men's life that they don't have, the libido. No matter what a woman does, it's not that maybe the women have done anything wrong to the men, but we were taught or we're told that when it gets to that stage, we women should really sympathize with the men and talk about it, because women will want to talk about menopause or the hot flashes. Have you ever heard a man telling you that libido kondo offering?
Yeah.
So men, I find it a bit difficult I find it very sad when men cannot come out. The talk we had, I think it was in Manchester or Birmingham. Yeah, but I could, when they were saying it, I could see men coming out. Oh, yes, it's true. And then people were giving examples, and these are black people. So when they started talking, I sat down and said, oh, God, we always talk about women. We don't talk about men, or men don't talk. But I think it is hard time that, Dr. Akos, I don't know if you can have men on the talk show for them to talk. Maybe because a man here until very. But if men really come around when they want to talk, they do talk.
Yeah.
So, Auntie Emma, are you saying that the audiences should be men, or the panel the speakers should be men?
I think the panel should be men, because there's this should be Africa for. I don't know, Saminka Iguana, me I say we choose me West. they relate more to their male counterpart. They can talk well to them. But when it's you know the ego will cry then or
But I genuinely believe that that's the same with females as well. I always say when I get female patients, or even when as a female doctor, when I see a female patient, it's always easier because you kind of almost understand when a female, like I remember when the male doctors learnt about menstruation and they were like, oh my God, like how are we going to remember all of this? And how are we going to remember that this happens? And we were kind of thinking, well, I've never had to learn about female cycle because I feel like, well, I live it. So it's never been like I've never picked up a book saying I'm going to learn women's health. Like it's not even something I've done before because do you know what I mean? I feel like I just turn up at the exam and I just write it because I live it. And if in the same way, if somebody comes to my GP practice to ask about advice about women's health, sometimes you even use your own experiences because like if it's mood swings or whatever it is, you're like, oh, this is what I do, or I have an experience. Whereas you kind of have to learn that. And the same way with me saying that I'm going to try and go into male health. Let's be honest, I don't know what it feels like to have an ejaculation. I don't know what it feels like not to have an ejaculation. I can't relate to a man if a man is telling me, oh gosh, and then I couldn't ejaculate. I'm going to be like, okay. Like for me, it's like, what's the big deal? But it's a big deal to men. I mean, I was talking to somebody recently about having a vasectomy, and they were like, so if I have sex, I'm not going to produce any sperm. And I was like, yeah, but why is that a problem? Because I mean, it's the penetration, not the. And then it was like, no, because when you ejaculated at the end of it, there's a feeling. And then I was like, okay, I don't know that feeling. Like I've never had to ejaculate before, so so I understand that from that point of view. That sometimes talking to somebody who understands what you're talking about, somebody who's walked in those shoes, so you can't just come and talk to a man. I can't go and talk to a man about when I was pregnant and this and that, because I feel like it's just gonna fall on deaf ears. Truthfully, do you know what I mean? So I get it, and that's why I feel like men really have to be advocates for men. Like men need to, and I agree with what you're saying. But I'm still gonna go into male health because I find it very
No. I mean, it's good. It's good for you to go through. And can I be honest with you? I had the opportunity to do. I was given 2 topics, and I was really scared. I was the men in our church. They had a men's meeting, so I was called in to just come and talk to the men, any health topic. So they gave me 2: diabetes and then prostate cancer. Do you know what I chose? I chose diabetes.
Oh, that's okay.
Because I felt this is church. Look at me, going to talk about, So I decided to do. But once I was talking, I was looking at diabetes. I had to really go into male just to find out, some of the things, that the impact of having diabetes on their the reproduction, and then men as a whole. And to my surprise, I was so shocked that talk has transformed a lot of men in my church. When I finished the first, we were meant to have my session diabetes. They gave me 45 minutes. I ended up using about an hour and a half, because when my time was up, I was alerted. But there were so many hands who wanted to just ask me questions. And I was so shocked. I thought, oh, you see people in church, you think, oh, you're knowledgeable, but no clue. And after the talk, a lot of people wanted to ask me questions. So I had to just tell the pastor, please, I'm so sorry. I don't want to have private, I'm a married woman, So can we just, and the second session was meant to be financial something, but they had to just stop that and then dwelt on this thing. And I've heard so many things that the men will call me. I mean, when they see me, they will even talk to my husband. Oh my goodness, what your wife has changed me. I've started eating well. I've started going to see my GP. Even one of them was seriously ill that he refused to go and see the doctors. But he was there. So I think women too can. But enkayenya elderly men no be nanka. Yeah, advertising in term, so that, and then the men, please, a man also, everybody get your. My husband most of the time listen to your programs.
Good.
So get them involved. Don't leave them, because when you leave them, they will just stay where they are. But when you get them involved, when you are listening to the cocotinam in China, I have to speaker. Sometimes my husband will ask me questions, and then me too, I'll come on to the listen to ask. So please, it's something which, what Taptap or what you ladies are doing is fantastic. You can't get this anywhere. And I'll say this, you can't get it anywhere. I can't tell you how many people will call me every day to ask me about one thing or the other. And sometimes people think that, Obisa question to do, and now she knows this. Because when they come to ask me, I've got to go and read and research. So it's really keeping me on my toes. So,
Yes.
Dr. Coase, please, if you can get middle age, for them to come and talk, I think that will help. And then, advertising and them, so that we can pull our men, and then they can listen, please. Thank you.
Okay. Thank you for the suggestion.
I think it's a good suggestion. This one, and Kwame, we'll put this one on you as well. Maybe you can help us advertise.
I'm just gonna ask a quick question. When you say at what age do they go through this? What do they go through? What? I'm just looking at your question.
Oh, I forgot him. I forgot him. Okay. You said something, and then I wanted to find out at what age. Yes, you were talking about it's not the menopause. You said something about men.
I think, well, the one that you said, at what age will the doctor check? That's what I'm not sure what you're asking
Checking
about.
your hormonal levels? Is it that?
Yeah, the hormone levels, The hormone levels.
Yeah, but I wouldn't, that's why I was saying I wouldn't check your hormone levels just because of your age. I would check because of your symptoms. So it's not about the age that I'm checking. Or were you talking about the female ones? When I said at the below 45 is when I would check female hormones, but above 45 I'm not checking female hormones as well. I said that's the guideline.
But Dr. Coase, can I just be honest with you? I do understand it's the cut in the NHS. I know you are not seeing my face and I'm hiding my face. But can I just say that when we put numbers or age to test and other things, I think we are really let me choose my words well. We'll miss vital.
I understand what you're trying to say. But the reason why they do that is because we have specificity and sensitivity. So essentially, there are several things that happens when you when we do research. So you have medical professionals or healthcare professionals who do research, and they come up with an age. And the reason they do that is because they basically find out that yes, you're right, there are people who might fall below the age of 45, but they've realized that the majority of people that they will not miss is above the age of 45 or something like that. I'm giving an example. So then they will set that age, because what you have to understand is the NHS is a free service and we can't test everybody. So if somebody is concerned or somebody is worried and they're not within those ranges, and they're not eligible to be tested on the NHS, then they can always get that test done privately. And again, just because we have those ages, it doesn't mean that if you go to a doctor and there's clinical reason to test you, the doctor is going to say no. This is what I was saying before. If there's a clinical reason for me to test somebody, I will test them. But the truth is that me testing you for menopause is not going to change your life, because the test for menopause is just telling you that you have menopause or you don't have menopause. And to be honest, I don't really need it. It doesn't make a difference to you. If it's a test for cancer, that's different. We always say, women start to get mammograms at a certain age. But if a 12-year-old were to come to me and were to say, I've got a lump in my breast, I'm not going to say, because you're not 50, I'm not going to give you a mammogram. Do you see what I mean? So it's just because it's a free service, we need to be careful how we use it. If not, we won't be able to do anything. But if it's a life-changing test, then we don't put a number on it. But if it's not a life-changing test, then of course we've got to put a number on it at some point. So that's why we do. I mean, menopause is not life-changing. Well, gosh, I say that so this is why so people are going to be like, you've not hit it, that's why you don't know. Menopause is life-changing. I apologize for that. But I mean, it's not like it's not a life or death situation. Like it's not going to be, it's not like a cancer situation. Or so if you're having menopausal symptoms, I can manage those symptoms without testing and saying, okay, you have menopause. Because all the test is going to do is to confirm that you've got menopause or say that you're not a menopause yet. But it doesn't make a difference to how I treat you. So is it really important for me to test it in the first place?
Okay. Thank you. This has been a very extensive discussion, and thank you, Auntie Emma, for the recognition of the show, and thank you to Taptap Send for allowing this platform to go on. So
Somebody's
all
laughing at me.
all hands on deck to bring this show to life. And thank you to the faithful watchers and audiences who have made this show a success. So I think just to end off, Dr. Akos, what would be your sort of like, I'm always going to ask this, one message or last closing statement or message you'd like our brothers and sons and nephews and all men listening and women who take away to the men who are not here to take away about hormones, like male hormone health.
I mean, for those who were not here from the beginning, today the topic was actually based on male hormones because obviously November is the month of sort of male health awareness. So we talked about prostate cancer previously and testicular cancer. Today we're talking about hormones, talked about testosterone and the importance of it. The main message I want you to take away is, especially when it comes to men, especially when it comes to African men, is that we need to talk and we need to be a bit more open. I know that there's a stigma around African men and, what we can talk about and how we have to be brazen and we have to be brave and, we don't talk about these things. But I always say that's why you have your GP. Okay, as a man, you don't have to go and sit in the bar or in a pub and talk to your friend about your low libido or you feeling fatigued. That's what your GP is there for. Use your GP. It's a confidential service. It's available to you and it's available to you at free of charge. So go to your doctor, talk about it, and hopefully, we'll be able to do the test and do what we need to do. For the females listening, because there's male health, I'm not going to talk about the women's side of things, even though we did touch on a little bit of it. But the main point is to encourage your male friends, your partners, your uncles, your brothers, your fathers, just encourage them to talk. Like I always say, women are very good at checking our health. Not all women, but most women or some women are. And if you're having a yearly checkup, why don't you just call your dad, tell your husband, oh, when's the last time you had a yearly checkup? Or when's the last time you saw the doctor for this and that? Or if you've noticed something about somebody, you've noticed, oh, they're a bit slower than they are usually, or that they're a bit, they're not quite themselves, you can say, oh, you seem to be a little more tired than usual. Have you thought about talking about it with your GP? So just encouraging them, creating these platforms, these safe spaces where they can feel like they can be heard and actually that they're cared for. Because sometimes it's like we women want men to notice everything about us, want them to notice our new hair, our new nails, our long eyelashes, but we don't notice things about our partners. Or when's the last time he's got stubble, he's not shaved for 3 days? Did you notice that? Is that usual for him? Is that mental health? Is that is that him? Is that a cry for help? Is that him saying, I'm not in the mood to do what I usually do? So yeah, just being a bit vigilant, creating that open space and making them also aware that we also care about them. And it's just important. It's just as important.
Great. Excellent. Thank you, Dr. Akos. And
Dr. Anna, I can see all your comments.
Just before we close off, just to remind you that tomorrow is same time, same link. It will be a time of Taptap Send, and on Friday, same time, same link. It's Ask the Lawyer. And just before we go off, I want to close off. Just before we go off, there is a long-standing member in the audience who has been missing for a very long time and today has decided to grace us with his presence. He is one of the OGs that started this with us. So a very special shout out to Jonas. And thank you for being able to join us today. It's nice to see you.
Watching me. I thought, hey.
I'm chill. Oh, bye, I'm chill.
Uncle Jonas.
It's nice to see you. Yeah.
But I was panicking, This topic, I was telling Jonas,
It's nice to hear from you, and it's nice to see you on the show. It's been a while, and it's good to see that you're keeping good. And yeah, please, this week, this month, we'll be doing a few male topics, and also Auntie Amma suggested that we'll try and bring male panels on there. So please bring your friends, encourage your male counterparts to come in and join us. And
Hello, Jonas. Thank you for coming. Oh, God.
Oh yeah, listen, I'm back for good.
Oh, thank God, because we've missed you.
Yeah, I know.
Sorry, I'm just trying to figure out how to end my live on TikTok. I don't know how to do this.
We are not Gen Z here, thank you.
So, I was just like, how do I do this?
That's fine. Anyway, so let's not take too much of people's time. But yeah, very lovely to see you. And since you're here to stay, I guess you'll be here next week as well. So that'll be great. Thank you. And just to close off, again, a big thank you to Dr. Akos for helping us to shed light on the crucial topic. And to all our listeners, to all our fathers, our uncles, our brothers, our nephews, and everyone else, please remember that paying attention to your hormone health isn't about vanity. It's about longevity and feeling best at every stage of your life as a man. So on this note, I would like to say a good night. I would love to say a good night to every one of you all, and see you all next week.
Bye guys. Thanks for coming.
Good night. Thank you.
Me did the young antechua, and maybe I'm discovered for Europe. I come a bush and for Ghana. No, me used to tap send. Tap send. No fee mobile money transfer. Eye easy, eye convenient, eye fast, and sounds so free. Won't you she? Me discover ye map him. Tap send. Intienne. Also download the Tap Send app. No, ever mobile phone so free. Na first ka come a bush and for Ghana for na. Tap send. Papa no.
So physical money and put me do right just for me send in a minute in Sabakandia and then one tap send.
Yeah, ebusiafo bidinti na nakuma pachrewa 1. They recommended Taptap Send amamo. And that's how for aba. O send ko fa baby a. Na ye basa. Omo rating so ye. Omo ye A1. Nti obian load do Taptap Send. Na on say sika fa Taptap.
Yɛbɔ de wo kyerɛ amansan yɛbɔ de wo kyerɛ Ghana for say yɛwɔ akwantu ne yɛde sika kɔfie nie me yɛn fɛmfa baabi a yɛbɛnu yɛn ho tap edemu fuwa tap send in this street
Na tap de no ana ɛkɔ.
Tap de and one na
Piao.
After successfully redefining Accra's skyline with the delivery of the signature apartments, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living. Thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Sultan Sky, a new perspective in the sky.